Conference will take place from tomorrow till the 14th of June at the International Convention Center in Durban. The theme for this year's conference is Unprecedented Innovations and Technologies, HIV and Change, and will also focus on unprecedented scientific, social and digital innovations, technologies which could facilitate or rather expand the possibilities and opportunities towards controlling the HIV and AIDS epidemic. This conference is the second largest HIV conference in the world, attended by over 3,000 people, 25% of which are from countries other than South Africa. Delegates include scientists, medical practitioners and representatives from the public sector, NGOs and faith-based sectors as well as the corporate sector. We talk about the conference now with Steve Letsike. Steve is the Deputy Chairperson of the South African National AIDS Council-SANAC, and she joins me now live from our studios in Durban. Good afternoon to you, Steve. Thank you so much for coming through, really. Now, let's talk about this conference. It's the 9th one. Let's just take stock and look at the previous 8 ones and see what they really have achieved.
Thank you so much, and really good afternoon to your viewers. Look, this is the 9th conference that we are having here in South Africa, and as you've said, it's the second largest conference in the world. Here we are, we're trying to look at the milestone, we're trying to see some of the initiatives that are taking place, but also confront the realities that are really challenging us in responding adequately and effectively in South Africa. In the past, we've seen where we understand our epidemic, where we know our response, and we've seen priorities given to communities, key population, and the marginalized population in that regard. But with this now conference taking place, with also the implementation of the National Strategic Plan 2017 to 2022, which is actually putting a little bit of pressure in South Africa in how we can reduce new infections, how we can put more people on the treatment as well as responding to the vulnerable and key population. But we also are doing this in the backbone of looking at how do we maximize with the political leadership, particularly in the implementation spaces, particularly in the province, in the district, and in the local areas. But we are challenged. We are challenged because of number of health crises that we see, and also some of the non-communicable diseases that, both HIV, TB, and other non-communicable diseases. But we are challenged with our health system, which is really challenged at local level, where we see crisis after crisis, including drug stockout, as it was reported last week. So here we are in the conference, and we're trying to address some of these issues and how we can come up with solutions, but from community level as well.
Talking about the challenges, really, as much as there are still challenges, we'll come to those a little later on, but there are also some positive elements to the problem that we're facing. There are strides really that have been made, because South Africa has the largest treatment program in the world, accounting for about 20% of people on ARVs. So we are doing well, of course, on that front.
Indeed, if we look at what we're doing with our treatment program, it is the biggest in the world. We have over 4.3 million people on treatment. I think the threat to that is the fact that we want to put 2 million more people on treatment in the next 2 years, but given the challenge of access and availability of medicine, it's something that we must arrest quite urgently. But what we have been doing good is really tailor-made intervention, particularly for sex workers, for men who have sex with men. And right now we are also trying to figure out how do we reach out to many more marginalized community. We are also reducing new infections amongst adolescent girls and young women between the ages of 15 to 24. 2 years ago, when we had this conversation, we said over 2,000 young women are infected weekly. But right now we are going below 1,800 as we see. It's a small pace in our effort of reducing new infection. UNAIDS through the 1990 process and also the Prevention Coalition, we had said that by 2020 we must get below 88 200,000 new infections annually. But right now we are still at about over 200 new infections annually. So 200,000 new infections annually. So we are really moving in a slow pace. So what we want to see is that efforts must be intensified. We must upscale efforts. So we can't back down. But we are also challenged with a financial fiscal response. We've seen Global Fund has committed over $350 million in the last couple of months for the next 3 years. We've seen PEPFAR having revisited a cut of almost 2 billion in the HIV response, but now it has revisited its decision. So also the domestic resources which our government puts, which is a large proportion going into the HIV response. But what we want to see is that efforts can't be minimized in any way. We can't cut down our effort. We need to maximize that in order to reduce the new infections and respond to the HIV epidemic.
And I think really part of the challenge that we're facing in South Africa is people not knowing their HIV status. I know that the Department of Health had some beautiful plans and program encouraging people to test voluntarily and get counseling. So the target now is what? To treat at least 6.2 million people with HIV by 2020?
Look, I think first we must really look at this 90-90-90 strategy. One, it's first 90, it's really about ensuring people know their status. It's finding the missing cases. People who do not know their HIV status are encouraged to test at least annually. People must test. But secondly, those who are HIV positive or found to be HIV positive must be immediately put on treatment, because what we know is that once you're on treatment, we can suppress the viral load. Once your viral load is suppressed, we really can, you really cannot transmit HIV, and we know that it becomes undetectable. So one of the studies that was released by Human Science Research Council last year spoken about the little number of men testing. We are calling on South African men in all their diversity to go out in their numbers, go test at the clinic, at hospital, and even at NGOs, services that are run by NGOs. People must test. So our target really is to reach 90% of people really to test and know their HIV status. But at the same time, we are saying let's complement it with other diseases that we know, like tuberculosis. We are encouraging South Africans to screen for TB. TB is #1 killer in South Africa. So we cannot back down. And we know the co-infection between HIV and TB is one of the major issues. So we have over 200,000 missing cases. It's airborne, and we want people to go and screen for TB. You know the symptoms, get educated on that. The target really speak to us, ensuring that we speak to the two.
Yeah. Now, just in conclusion, Steve, I know June is Pride Month, and you one of the LGBTIQ plus activists. Let's talk about the prevalence of HIV and AIDS in that community, and perhaps the transgender community as well. And I think many of us really do not know that South Africa is one of the few countries around the world who have included the needs of the LGBTI plus community in its national response to HIV.
Yeah, indeed, we were quite excited when President Ramaphosa, in that time he was the deputy president, chairing SANAC at that time. In 2016, we launched the first in the world South African LGBTI HIV plan, which have prioritized LGBTI community. One, we understand the prevalence when you speak to men who have sex with men, particularly up to about 40% of HIV prevalence. But also when we highlighted issues that are affecting transgender persons. Transgender persons are 49 times higher of contracting HIV than any adult of reproductive age. And luckily, this week again, last week we have presented for the first time 2 studies. One, it is the study that was done in conjunction with Human Science Research Council, Access Chapter 2, and many Gender Dynamics and many other organizations. And these research was giving us the results of biobehavioral survey amongst transgender women. The second study that again will be shared, was done last week but will be shared during the AIDS conference, is the Why We Matter study, which was focusing on transgender women reality in Gauteng. And part of this study, what we are finding out is challenges with access to services, but also the health-seeking behavior that transgender women have once they are put on treatment. They have access to hormonal therapy and also access to surgical care. What we know is the biggest challenge is access to hormonal therapy and surgical care, which also does play a significant challenge for transgender persons in order, it actually does promote vulnerability. Mm-hmm. The fact that we are not addressing the social and structural reality which does impact or affect the biological effects.
All right, Steve, we'll leave it at this for now. So we'll extend an invitation to you after the conference to talk about issues that came out of the conference and perhaps their recommendations going forward. Thank you so much for coming through.